I think what we understand now is we need to think very differently about an infectious disease spread, and one that is so widespread, and really take this opportunity to shore up our disaster efforts. We are an enormous state, 58 counties, largely where that public health leadership lies. And I think one of the things that we understood is that we really need to pull together and have perhaps more streamlined planning and decision making as it relates to an event of this order of magnitude. There is, I think, a tsunami of behavioral health issues we will be dealing with long after a vaccine is available and herd immunity is achieved. And now's the time for us to really come together and get very creative about solving these problems. California can do great things together when we come together, but I think we're going to have to set aside some of the rules that have not allowed us to create an integrated behavioral health system before, to some of Anthony's comments earlier about the broader system, but we need this now. While we've seen improvements in personal protective equipment and its availability, we still are seeing shortages. One of the challenges now, as new manufacturers are getting involved in the production, for example, of N95 masks, it's important to understand, especially in healthcare, that it's not just the filtering function that you're looking at, it's the design and how that mask fits, because in healthcare, it's got to be sealed. It has to pass certain kinds of tests. And we know that as different manufacturers are coming into the market, some of those manufacturers are failing the fit test. And we just can't have that with the nurses and doctors and nurse practitioners and others. Could we invest in additional capacity? And by capacity, I mean not just space, but stuff. That has a cost, right? It will add to the cost of the healthcare system. But certainly what we learned is just in time doesn't work in a pandemic, and market competition is a challenge in a pandemic. This is going to be a long haul. And I hate to be the doom and gloom, but I really think we are looking at addressing COVID-19 well into 2022. And I think it's going to be harder and harder for other sectors of the economy to hold on. And I do think we're going to see job loss. I think we're going to see increase in Medi-Cal roles. Now is the time for us to really have that conversation.